Dr Katie Barber, good morning to you.
Good morning, Kat.
Now, first of all, it's World Menopause Day. But why on earth don't we have conversations like this more often? Why is there so much stigma around the menopause?
Well, I think this is a historical thing from women seeming to think this is a natural process they should go through and just deal with on their own. But actually, we spend half our lives now living in peri or post-menopause. And some women, it happens far earlier than that. And so it's a massive impact on our lives, not only personally, but also our working lives. And it affects our ability to function. So I think the conversation, fortunately, is turning around and people are starting to talk about it. But there's still a lot of embarrassment behind it. Women are a bit anxious about mentioning it. Is it something I should be asking for help with? Is it something I should just deal with? Maybe I shouldn't be making a fuss about it, which is a real shame.
Yeah, actually, it has a real impact on relationships as well, doesn't it? And I think, I want to talk to men as well this morning, because it's really important that men actually get a sense and an understanding of what the menopause means for a woman. And I remember my mother going through. I didn't know it was the menopause at the time. I was in my teens. My mother was 55 when she went through it, and I didn't know what was happening to her. She was having palpitations. She was having hot sweats. She was feeling very, very faint, and I had absolutely no idea, because she didn't tell us. She didn't tell us what she was going through, and that's why I feel that I'm probably knocking on the door of the menopause, and I will absolutely, I intend to be very honest with the people around me, actually, and my daughter as well. But in terms of where you are at your stage of life, are you perimenopausal? Have you been through it?
Well, it's really interesting, Kat. I was just talking to a researcher about this because, I've been a menopause specialist for many years, but sometimes you don't even recognise the symptoms in yourself. And I started to develop perimenopausal symptoms last year in my early 40s. And it took even my own expert brain didn't recognise what was going on, because we attribute them to other things. Oh, I'm a busy mum of two. I'm working very hard. And actually, my husband, who's non-medical, turned around and said, well, lots of these symptoms you're mentioning, Katie, actually are the ones you say the perimenopause is related to, and women experiencing when they're running up to the menopause. And I felt very empowered knowing what I need to know to get the right help from my GP. But I know there's many women out there who perhaps don't have that knowledge or don't have that confidence to go and ask for support. So it's really important, if women are struggling, like you say, it's not only them themselves, but also the people around them, partners, children, people they work with, recognizing those changes and alerting them.
And actually, some of the language all around this, it is quite difficult to understand. Perimenopausal, what does that actually mean, Katie?
Well, it's a bit of an arbitrary term, Kat, because, we define post-menopause. I'll come to perimenopause in a second. Post-menopause means you've more than 12 months from the cessation of your normal menstrual periods. But that's sort of almost the door's shut at that point. Perimenopause is just any period of time running up to when your periods stop altogether and your ovaries stop functioning completely normally. And it's that decline in estrogen and testosterone that happens before you reach that point. This is often when women struggle with the most symptoms. So if you wait until your periods stop and then go and get help, you've almost missed the boat for a lot of women. And that's the time when those symptoms are really debilitating, when we could actually get treatment in that can really make a difference to women's lives.
And we will come to that, actually, the help and the support, because that's really, really important to know where to go. But in terms of your cycle then, do your cycles start to get shorter? Is that perhaps, a warning sign that you've hit perimenopause when your cycle becomes shorter?
It can be, but actually your changes in your menstrual cycles are often not the most obvious symptoms. Sometimes it's the more subtle symptoms like loss of brain function, hot sweats, night sweats, hot flushes, insomnia, difficulty with processing your normal thought processes, cognition, mood changes. Often women describe becoming quite mentally fragile, increasingly anxious about things that they'd normally not be too bothered by, very sad, tearful very easily, emotionally just not themselves. A classic one I know from many women that have been to my clinic is, I just feel like I am more snappy with my relatives, my friends. I haven't got a lid on my emotions anymore. And actually for many women, although normal menopause, we expect women to become become menopausal from the age of 45 plus. A lot of young women are having menopause well before that. About 1% of the population have a menopause before 40. And the menstrual changes are often not the most significant. Yes, your cycles become shorter in some cases. Sometimes they become more infrequent, so you have longer gaps in between your period cycles. But it's so individual and unique for every woman. I think that's what we really need to emphasize, is no two women have the same menopause.
And that's precisely actually what I want to talk about, because, some women really, really suffer with menopause, and they are really very ill, in fact, whereas some women, like you say, they sail through it. But let's not forget, actually, if a young woman goes through the menopause before the age of 45, and let's face it, a lot of women are having, if they choose to have children, they're having children later on in life, and actually that menopause then takes away that having children from them, basically. So that takes that away altogether. So actually the impact of menopause on a younger woman is huge. It's absolutely massive.
It is. And I think because we are seeing younger women before the age of 40, in a lot of cases having a very early menopause, it's not just the symptoms that cause them grief. It is the impact on all those other aspects, as you say, fertility aspects, huge numbers of women leaving their children till later because of career or choice. And not only are you given a blow that you're in menopause, but then it's also the infertility associated. The other thing to say about young women is that an early menopause, particularly in women under 40, has massive deleterious effects on things like bone health, brain health, and cardiovascular health. So for very young women, it's really, really important that they get help, and the right help, to get them on the right track with hormone replacement, so that they can not only feel well, but those adverse effects are also minimised.
Yeah, I mean, it's really about empowering women to have the confidence to speak to a doctor about this very early on, isn't it? And actually for them to be, met with the proper support from the GP as well.
Absolutely. I mean, I'm a GP as well as a menopause specialist, and I know we're obviously extremely busy at the moment. There's lots going on, but there's so much you can do to then get the information yourself to feel empowered to go and get help. I think, unfortunately, there's still a lot of stigma attached to certain aspects of the menopause and women asking for help, but also the treatments available. Fortunately, the knowledge is improving, and healthcare professionals are realising that actually the treatment options are variable and extremely safe for the majority of women. There's fantastic resources out there that women can access to improve their own knowledge base, and then be confident that they're asking for something that's really going to help them. But I'm all about education and teaching. I do a lot of teaching both locally and nationally to try and improve healthcare professionals' knowledge of the menopause and also the treatment options available.
Yeah, I mean, we are unfortunately hearing a lot about women not getting the attention that they deserve, when they're speaking to GPs about this, which is heartbreaking, isn't it? Because actually it's sometimes it's difficult for a woman to go to a GP and ask for that help if they're going through the menopause, but actually not getting the help, the advice and the right treatment, in fact, that women deserve going through this.
Oh gosh, completely. I mean, I had a patient a couple of weeks ago who produced 5 or 6 packets of pills when she came to see me, and only one of those packets was actually helping her with her menopause. Antidepressants being given for the wrong reasons, treatment for other things that actually, if you just think about what the root cause is for that woman's symptoms and provide the right hormone, which inevitably for most women is estrogen, all these symptoms get so much better. There's still a lot of misinformation about the breast cancer risk and the safety of HRT. And I think that sort of cloud of doom almost hangs over some healthcare professionals of, oh, I mustn't give HRT, it's going to increase this woman's risk so significantly.
Yeah.
Whereas actually for most women, it's extremely safe, significantly beneficial for the majority of women. And actually you can do a huge amount to help these women function and live the life that they should be living.
Yeah, well, in fact, you mentioned HRT, and I know that there's, a lot of misconceptions actually around HRT, but we'll get to the bottom of it. And Dr Katie Barber, she's a menopause specialist at Oxford Menopause. If you do have a question for Katie, please do pick up the phone. Don't even have to give us your name, but just pick up the phone if you've got a question. Maybe you're considering HRT, but you're not sure. Whatever question that might be about the menopause, we're having a frank discussion this morning. 0808 100 9 100. Now, let's return to our frank and open and honest discussion around the menopause this morning. My guest is Oxford menopause specialist Katie Barber, Dr Katie Barber. If you do have a question for her or you want to share your experience, you don't have to give your name, but if you want to share experience, because that, I would imagine, will help other women going through this and indeed men as well. Because it's important, of course, that men understand what women go through when they go through the menopause. But Dr. Katie Barber, welcome back. Right, HRT. I think there are so many worries and concerns and misconceptions and myths, actually, around HRT. And I think it's absolutely essential that we put those to bed right now.
I think that's so true. And I think the benefit for women of HRT is significant for the majority. This is essentially replacing the hormones our bodies are just not naturally producing anymore because our ovarian function has declined. We've essentially run out of follicles that produce eggs. And for many women, it's not just a quick, short, sharp, right, that's done and dusted. It's a progressive loss of those hormones that then affects us on a day-to-day basis. And HRT is merely replacing those hormones to allow us to eliminate the symptoms related to estrogen deficiency primarily.
So why has there been concern around taking HRT in the past? I mean, I just remember, if I relate it to my own mother, she didn't want to take HRT because of perhaps the misconceptions surrounding it.
Absolutely. I mean, there were some studies back at the early part of the sort of 2000 mark, 2002, which were really looking at different cohorts of women. A lot of the studies looked at American women a lot older, in their late 50s, early 60s, and also with different characteristics to the British population. So a lot of those women were extremely obese. And we know obesity is a huge risk factor, not just for breast cancer, but all cancers. So those studies had certain issues associated with the risks they were portraying to women. And it caused an awful lot of women to stop taking HRT and women reluctant to even start it in the first place. But we've had subsequent data that shows that for a majority of women, any risk of breast cancer associated with HRT is very small when we look at lifestyle risks such as smoking, obesity and alcohol. And for the majority of women, the benefits of HRT absolutely outweigh the risks.
We do hear a lot about blood clots, though. Yeah. So, when we're talking about HRT. So what are the risks in terms of women developing blood clots if they are put on HRT?
That's a really great question, because actually, even from healthcare professionals, that's a common query I have as an expert. I've told this lady she can't have HRT because she had a blood clot 10 years ago. For oral estrogen, i.e. tablet form of estrogen, and then you have to get the components of HRT very clear in your head with this. It's the estrogen component taken in a tablet form that does increase your clotting risk. The real luxury of HRT management nowadays is that we have lots of transdermal HRT. So this is estrogen given through the skin. That could be in a gel, it could be in a patch, it could be in a spray. And the studies have shown that using estrogen through the skin in those forms does not increase your clot risk whatsoever. So this has really allowed women who've had previous clots in their legs, previous clots in their lungs, women who are at an increased risk of having clots to still be allowed to take HRT safely. Yeah. So yes, certain types of HRT, not a good idea if you've got a clot history or a past history of clots, but for women using transdermal estrogen through the skin, perfectly safe.
What sort of things then, if you can't, and you just can't take HRT for those reasons, or maybe just, you've made the choice that you don't want to go onto HRT, what sort of alternatives are there?
Well, the first thing we talk about, any healthcare professional talking to a woman going through the menopause, is all about lifestyle modifications. Think about the things that are going to improve your quality of life: keeping fit, losing weight, avoiding smoking, excess alcohol. Alcohol and caffeine are notorious for triggering flushes and sweats. If you can minimize those, that's great. There's fantastic data to suggest the supporting use of CBT, cognitive behavioral therapy, to allow you to manage what's going on with your menopause. There's also treatments, although I said earlier that we shouldn't be giving women antidepressants as a treatment for their menopause, for women who in HRT is contraindicated. So these are women with female cancers driven by estrogen, so typically breast cancers, certain types of ovarian cancers and womb cancers. We would use antidepressants purely to control hot flushes and sweats because there is evidence to suggest they help in those circumstances. And there are also some other drugs that we use for other conditions, such as certain types of painkillers that can be used to treat those symptoms. They're not as effective, unfortunately, as hormone therapy, but for some women in whom putting them on HRT would really significantly increase their risk of, say, a recurrence of their cancer, those are still options they can consider.
My mother said to me not so long ago, get yourself on B-complex. That's what helped her. Of course, it's not going to help everybody, and different things help different people, don't they? But that was my mother's advice to me. But actually, Lou in Carterton has been in touch with a question, and she says, on average, how long will the menopause last for?
Gosh, that's $1 million question. Oh, and I'd love to be able to say, 6 months, 12 months, whatever, but it's so different for every single woman. And I think this is where it's really impossible to say. About 96% of women are what we define as postmenopausal by the age of 55, 56. That means their ovaries are no longer producing hormones in a significant amount. But the side effects of that menopause doesn't necessarily stop at that time. And that's the really important distinguisher. It's not just your ovaries stopping working, it's how long the effects of that ovarian function declining and stopping has on you individually. And for some women, it might be 6, 12 months of symptoms. For other women, it can be decades. And I'm seeing more and more women coming forward, not just below the age of 60, but in their 60s, 70s, and even 80s, 90s, and saying, I was told I can't have HRT anymore. Is that really true, or can I choose to continue to take it?
Now, James Timpson, the chief executive of Timpson, tweeted this today, actually. From today, all my colleagues can claim on expenses their prescription costs when they are recommended HRT. Now, it's so important that we support our colleagues going through the menopause. I mean, what do you make of that?
Oh, that is just music to my ears.
Yeah.
I think, it's just wonderful that there's been so many public figures really advocating for women to come and ask for help for menopause. Employers like Timpson's, that's absolutely superb. I know there's lots of lobbying going through in government at the moment about changing legislation so women in the UK can have HRT across all the different aspects, not just Scotland and Wales, but also England as well. And that for me is really important. Contraception is free. Why shouldn't we be giving women HRT? It's a huge impact on the economic function of the UK when women can't work normally through their menopause. So that is just amazing that that's happening.
Do you know, we're not going to leave this conversation here. We are going to have another conversation. I just feel that, however informative, we've just literally just sort of done the tip of the iceberg as it is, I suppose, with you, Dr. Katie Barber. But we're going to continue this conversation, and we will do so in the coming weeks and months. I think it's incredibly important. And like you say, just James Timpson, the chief executive of Timpson, that tweet, that's a real turnaround. And hopefully that's a sign of things improving amongst workplaces for women, actually. So thank you so much for being our expert this morning, Katie. We will definitely speak again. Oxford menopause specialist, Dr. Katie Barber. And if any of this is ringing true with you, do get in touch with me right now. I'd love to hear your menopause experience as we continue to break down that stigma. And we're not done yet with menopause.
BBC Radio Oxford.